this is video 24. So we will continue with the hemodialysis and peritoneal dialysis. We will see. So in detail we will see what is hemodialysis, why it is done, how it is carried out, what are the complications of doing hemodialysis. Okay, so I hope you're all checking into the classes. Make sure you check all the teachers' classes, don't keep it like that. Okay, so you have to go through all the classes. Notes are also have been sent. For those who have notes, you please study. For those who don't have notes, make a note of it, write down and study. None of the classes will be repeated, and get ready. We don't know when all of a sudden your exam also will be announced, right? So it is good for you to keep everything intact. Don't wait until last moment, and don't wait till the end. So we'll continue with the topic, care of patient of hemodialysis. There are also certain pictures apart from the book pictures I'll be posting, so please go through. That gives you a clear picture. Okay, so any extra points what I'm saying, please add to your notes also. So dialysis, when you say, it is primarily used to provide an artificial replacement for lost kidney function, that is renal replacement therapy due to renal failure, temperature of solution, pore size of membrane, molecular size. So basically, when do we use this dialysis? It is an alternative method, like when the lungs does not function, how we use ventilator. So when the kidney is not able to function, when the kidney is not able to remove the metabolic waste from the body, is when the artificial kidney is used, which is called as dialysis. Okay, so two mechanism in dialysis. So when you see in dialysis, basically it works under two principles. One is diffusion and one is osmosis. So diffusion, when you say, it is a movement of particles from an area of high concentration to lower concentration across a semi-permeable membrane. So osmosis is just opposite, when the movement of water happens through a semi-permeable membrane from a lesser concentration to higher concentration. That is called as osmosis. So inside the dialysis, okay, so dialysate, you will see that it functions on the basis of two mechanisms, that is diffusion and osmosis. Moving of the water, okay, from the higher to lower through a semi-permeable membrane is called as diffusion. Osmosis is just the opposite, movement of water from lower to higher concentration through a semi-permeable membrane. Okay, so next we will see what are the various indications where we have to do this hemodialysis. So the decision to initiate dialysis or hemofiltration in patients with renal failure depends on several factors. These can be divided into acute or chronic indications. Indications for dialysis in the patient with acute kidney injury are metabolic acidosis, in situations where correction with soda bicarbonate is impractical and may result in fluid overload. So we know that patients, when their pH goes less than 7.4, we say that to be metabolic acidosis. So here we get to see, and metabolic acidosis, usually the oxygen level also decreases, okay, and the carbon dioxide level goes high. Okay, so acidosis, when it is of acidosis, we usually give soda bicarbonate injection, through IV it is given. So after giving that also, if it is not working on the patient, then it is important for a patient who is having metabolic acidosis that he has to undergo or she has to undergo the dialysis. Next, electrolyte abnormalities such as severe hyperkalemia, increased potassium in the blood, especially when combined with AKI. AKI is nothing but acute kidney injury. So hyperkalemia can actually cause problem to the heart also. So in this condition, again, the patient will have to undergo dialysis. Then intoxication, that is acute poisoning with a dialysable drug such as lithium or aspirin. So when the patient has been on the drugs where he has become poisoned now because of the overdosage like lithium or aspirin, then the patient has to undergo dialysis. Fluid overload, not expected to respond to treatment with diuretics. So as we seen already, if when bicarbonate is not working, and it might actually result in fluid overload. So in conditions when the patient has got fluid overload, then the patient has to undergo dialysis. Okay, then intoxication, that is acute poisoning with dialysable drugs such as lithium, that we have already seen. Complications of uremia such as pericarditis and encephalopathy. So what happens, it also leads to brain disease or heart inflammation of the pericardium, when there is increase of uremia, which is the nitrogenous waste substance, when that increases. So when the kidney is not functioning automatically, there is uremia, right? So that can affect the pericardium, leading to pericarditis and encephalopathy. So to prevent that, the patient has to undergo. Okay, so those are the acute indications. Now we will see what are the chronic indications for dialysis. So here, symptomatic renal failure, when the patient exhibits signs of renal failure like swelling in the foot, or fluid overload, itchiness, okay, and then we see that patient ends up having decreased urine output, hypertension, okay, all these are few signs. So when the patient starts exhibiting the signs of renal failure, low GFR, glomerular filtration rate. So usually when we see it's always recommended to commence at GFR, okay, at less than 10 to 15 milliliters per minute or 1.73 meters square. Diabetes dialysis is started earlier. Difficulty in medically controlling fluid overload, serum potassium and serum phosphorus when the GFR is low. So basically when the GFR or glomerular filtration rate is low, okay, so the amount of the blood that is flowing through the glomerula every minute, if it is low, then it is also indication of renal failure. Okay, so in that case again the patient has to undergo dialysis. So what are the goals of undergoing dialysis? It reduces level of nitrogenous waste, correct acidosis, it reverses electrolyte imbalances, it removes excess fluid. It is just the opposite of what we have seen in the indications of acute and chronic indications. Okay, so these are the main goal. Next we will go to two main types of dialysis. Under that, first we will be dealing about hemodialysis and peritoneal dialysis, are the two types, out of which first we will be dealing about hemodialysis. Okay, now when we say hemodialysis removes waste and water by circulating blood outside the body. So I'll just explain to you how it works. So we will be studying about the shunt and the fistula also from the artery, okay, because artery will be having pure blood, but here in case of renal failure, what happens, the nitrogenous waste is still not removed from the body. So it is said that every 3 weeks once, sometimes 3 times in a week also a patient can undergo this dialysis. So the way the cost also varies. In a government hospital it is somewhere 200 plus, but when the patient does it in the private hospital, then it goes about 1000, 1200, in that range. So when the patient, now we know in the artery also the pure blood, still nitrogenous waste is found. So what they will do, they will insert a needle in the artery, and then they will take from the machine, okay, from the artery machine, what will happen, that is which is taken from the patient, it will be sent into the machine. So the blood is removed for cleaning, okay, from the artery, remember arterial blood. Then as the artery blood is flowing, what they will do is arterial blood pressure also will be maintained, okay. And then when the artery blood is still flowing after monitoring of the arterial blood pressure, they will be giving heparin. So in the dialysis itself, you will see that the syringe will be connected and with an normal saline hanging. Okay, so saline solution will be given with shots of heparin, so that the blood as it is flowing into the machine, it will not get clot. Okay, then you have this heparin infusion will be there connected to the normal saline, that it enters into the blood pump. The blood from the patient is removed for cleaning. Then ABP is checked, that is arterial blood pressure is checked. Then heparin infusion is given through the normal saline and heparin in order to prevent clotting of the blood. Then it enters into the blood pump. So as it is entering into the blood pump, from the blood pump when it is flowing into the dialysate. Now dialysate will do the functioning of a kidney. Okay, so it has got lots of fibers in it. Okay, and through diffusion and osmosis, okay, and the cellophane membrane, it has got cellophane membrane, so it will be doing the function of kidney. So in that they will flow the fresh dialysing solution also will be poured, okay, and then used dialysis solution will be drained outside. Okay, they will keep a there will be a bucket, okay, where it will be drained, used one, and new will be poured. You can see everything in the diagram, I will be posting it, okay, it is very clear in that. So as the blood is flowing from the blood pump inflow pressure monitoring will be done. So as it is flowing into the dialysate, as I told you, dialysate has got cellophane membrane, it has got lot of fibers. Then through the mechanism of diffusion and osmosis, there is the purification of the blood that is happening, and then we see that how fresh dialyzing solution is poured and how the drained, okay, how the used one is drained outside. So after this, from the dialysate, once it is getting purified, it will move, okay, it will move into the machine to venous pressure monitoring. Okay, so it will now again measure the blood, monitoring will be done, and it will also detect if there is any air bubble that is found. Okay, if it is there, it will be removed. Then the cleaned blood will be sent into the vein of the patient. So remember, from the artery we are removing it and we are sending it to the vein. Why? Because we know that from the artery the blood actually goes to the to various parts of the body. And once when dialysis is over, automatically the venous blood will be taken. It will be going into the lungs and blood for purification again. So whatever purification has to be done by the lungs, that will be continued. It will go into the heart and it will be circulated to the various part. So we will send it to the vein for further purification in the lungs and the heart. So from the heart again it will enter into the purified blood, will be entered into the blood, and it will be supplied to other parts of the body. That's why we remove it. So once what happened, again kidney is not functioning, right? So after we do after a week, or say after 5 days, when the patient is again going to do the dialysis, its artery blood also is not purified, because nitrogenous blood is waste is not removed from the kidney. So again they will start purifying from the artery. The blood will be taken and it will be sent into the blood will be removed and arterial blood pressure will be monitored. Then apparent solution will be given, infusion will be there. Then the blood will go to blood pump there, where the inflow pressure monitor will be done. So they will check the pressure, okay, as it is entering into the dialysate. And then in dialysate you should know that they will use fresh dialysing solution and the used one will get drained out. And you will see the dialysate, it works in the mechanism of diffusion and osmosis. It has got cellophane membrane and lots of fibers which does the work of the kidney. From there again venous blood pressure will be maintained, monitored, air trapped. They will check if there is any air and the air bubble, anything is there, that will be detected and that will be removed, and the clean blood will be sent once again into the vein. So this is the process of hemodialysis. Okay. So hemodialysis removes waste and water by circulating blood outside the body through external filter called a dialyser. We use a dialysate. Okay. That contains a semi-permeable membrane, cellophane membrane, as I told you. In hemodialysis, patient's blood is pumped through the blood compartment of a dialyser, exposing it to partially permeable membrane. The dialyser is composed of thousands of tiny synthetic hollow fibers. So this dialysate has got tiny, very numerous hollow fibers. The fiber wall acts as a semi-permeable membrane. So this fiber wall acts as a semi-permeable membrane where the fluid will shift through osmosis or diffusion. Blood flows through the fiber, dialysis solution flows around the outside the fibers, and water and base move between two solutions. The cleansed blood is then returned via the circuit back to the body. Ultrafiltration occurs by increasing the hydrostatic pressure across the dialyzer membrane. This usually is done by applying a negative pressure to the dialysate compartment of the dialyzer. This blood gradient causes water and dissolved solute to move from the blood to dialysate and allows the removal of several liters of excess fluid during a typical 3 to 5 hour treatment. Studies have demonstrated the clinical benefits of dialyzing 5 to 7 times a week for 6 to 8 hours. These frequent long treatments are often done at home while sleeping. So it can be done even at home, but when we say hemodialysis, it is always good that they come to the clinic or the hospital and they get it done. So diagram is here, but I will post better diagram in which you will be able to understand. Looking at the diagram, you should be able to explain. Okay, so whatever I have explained, so much you can write. It is more simple than what it is given here. Then when we say types of venous access for hemodialysis, you have extra shunt. Okay, so usually they will make an extra shunt where the cannula will be placed in a large vein and a large artery. Separately they will place. So one outlet will be where the blood is actually going into the purification. From after the purification, it will enter into the vein. From artery, blood will flow, it will enter into the vein. Okay, so external shunt which provide easy and painless access to bloodstream. So every time they go, they have to prick and they have to start, are prone to infection. So because of this, they are also prone to infection and clotting and causes erosion of the skin around the insertion area. Next you have atriovenous fistula or graft. So what is fistula? For example, they can do it in the brachial or they can do it in the radial. Now what they will do here is, they will take the artery and they will connect to the vein. So why are they doing that? Because we know that the whole body's blood has to be drained out for purification into the dialysis. Now when we prick artery, it is not sufficient. Okay, and the vein also we know that it is very thin. Okay, from artery the blood will flow. Okay, but then what happens to the vein? Again the blood has to enter into the vein and reach the body parts, right? Mainly to the lungs and to the kidney, lungs and the heart for further purification. So now when the fistula is an abnormal joining which is made between an artery and the vein. So here in the radial, or it will be done in the brachial. So what they will do is, they will join the abnormal joining between an artery and the vein will be done. So what will happen, because of this fistula, when it is done, the length and the strength of the venous walls also increases. So it becomes easy for us to inject the blood into the vein. So when they are doing it in the the fistula, when it is done, this actually takes 3 to 4 months to heal. After that only they can use it. So till then they have to use other vein or artery to do the purification of the blood. Now we also call it as graft. So instead of just joining, what they will do is, they will take a plastic tube and they will insert between the artery and the vein, which will be like U shape. Okay, U shape when they put it here. Okay, so that is called as graft. Okay, so when they do that, larger artery and vein are sewn together, which is anastomosed below the surface of the skin. So under the skin they do it, or subcutaneous graft using the saphenous vein synthetic prosthesis or bovine xenograft. They can also use saphenous vein, which is the largest vein, or they can use synthetic prosthesis, artificial one, or bovine, which is got from the animals. Bovine xenograft, which can be used to connect the artery and the vein. So the purpose is to create one blood vessel for withdrawing and returning blood. Okay, so when they keep from artery, they will draw the blood, and the other side it is easy to send the blood through the vein. Advantage is greater activity range than AV shunt and no protective asepsis. Okay, so disadvantage is necessity of 2 venipuncture with each dialysis. So of course we will have to puncture both the sides in order to send, and that is one of the disadvantage. So from the artery you drain the blood for purification. Once it is purified, check the venous blood pressure, trap for the air bubble that is found, and then it will be sent again into the vein. Okay, so vein catheterization, femoral or subclavian veins are accessible. So in case when you have formed a new graft, your graft actually heals within 3 weeks. Fistula takes 3 to 4 months. So in that case you can either use subclavian vein or femoral vein in order to send the blood after purification, maybe short or long term duration. So external shunt is, you do not have any kind of abnormal joining of fistula. So what you do is, you try to insert it through the needle. Okay, so every time you have to insert. And then arteriovenous grade, where artery and the vein is fused together, anastomosed together through a graft or through a fistula, and then making the vein stronger. Here also 2 pricks should be there, but it is always available, easy to access. Vein catheterization, only vein, okay, we have seen. So in that case, again we will be able to use, again if you want to prick artery, then you can take either from radial artery or femoral artery. Next you have sub-nursing considerations that you have to keep in mind with hemodialysis. Before the hemodialysis, allow the client to void. Make sure he passes urine. If he is on catheterization, no issues. Document the client's weight, obtain vital signs. Then check the medication history of the patient before the procedure, like if he is on any antihypertensive drugs, sedatives and vasodilators to decrease the blood pressures. Okay, is given in order to do away with hypotensive episode. What happens usually when this thing is done, there are chances for the patient to have low blood pressure. So again, it should not lead to further low blood pressure. So make a note, if the patient has been on hypertensive, ask the physician whether it has to be given or not, or should be given after the dialysis, okay, in order to prevent hypotension. During the dialysis, hemodialysis, what all should you do? You have to obtain vital signs periodically 30 minutes. So blood pressure monitoring is very, very important. See, for any allergic conditions in the patient, so every 30 minutes you keep a check. Observe body alignment, allow frequent position changes. So 3 to 4 hours or 5 hours, the patient cannot lie in the same position. See if you can give a comfortable changing position to the patient. Monitor for episodes of any nausea, vomiting which can occur because of the procedure. Monitor for signs of bleeding by taking clotting time about 1 hour. We have to see, because we are pricking, right? So bleeding time has to be checked about 1 hour before the client comes only. We have to check, okay, of the machine. Then observe clotting time 30 to 90 minutes while on dialysis. Normal value is 6 to 10 minutes. So it is important that we see the clotting time and the bleeding time. Okay, so that is during hemodialysis. Now after dialysis, check the patient weight, note any difference, assess for complication, check for signs of bleeding, status of the fistula, check out for urinary output. That is not there, please write down. After dialysis, again vital signs checking also is very important, mainly with blood pressure. Next, complication of dialysis. The various complications are hypovolemic shock, result of what can happen because the body fluid is removed, right? The blood is removed. So result of rapid removal or ultrafiltration of fluid from the intravascular compartment, it can lead to hypovolemic shock. So we have to be very careful. Headache will be there, hypertension will be there for the patient, agitation, okay, then disorientation, twitching of the muscles will be there for the patient, and then the patient can also have convulsions. You can also include like low blood pressure can be there. Sometimes with hypertension, patient can also have low blood pressure. Then sepsis, if aseptic technique is not followed, it can lead to sepsis. Muscle cramps, already we have seen twitching of the muscles or muscle cramps can happen to the patient. Then sometimes the patient can also have itchy skin. Okay, so these are all the various complications of dialysis, hemodialysis. So with this video I am ending. Next video we will see about peritoneal dialysis.